from the Physicians Advisory Group, Dr. Felix Cabrera, joins us with that lockdown hairdo. Everyone's got it, Doc.
Yeah, good morning.
Good
Good
morning.
morning.
How you doing this morning, Doc?
I'm doing well. I'm doing very well. Can't complain overall. And so, how about you, Chris and Sabrina? How's your health?
We're feeling good. Worked out yesterday. I did squats in the kitchen.
I slept really good
Nice.
yesterday. You got to work out.
Yeah. Just trying to
Well, it's a
stay.
great thing.
Yeah, go ahead, Doc.
No, I'm saying it's a great day when people are really advocating for exercise. And again, it's one of the things like was said earlier that you appreciate it more when that liberty is taken away, temporarily, but it makes you really appreciate it in a different sense and appreciate our island's beauty and how much we want to get back out there. And so, but good. So everyone who's complaining about exercising, once everything's lifted, I better see you out there exercising.
By the time everything's lifted, I'm gonna have abs. I think.
Yeah, abs of
Flabs of steel. 10. 6:51, Doc. So I guess we'll just start off because we're getting Dr. Hoa on, and you guys all have different hats in the PAG. We'll go ahead and we'll discuss first the mobility data. Now we'll take it back to when we had Dr. Wen on before this stricter lockdown was announced. We had heard that the mobility data from PCOR 3 to PCOR 1 was actually pretty similar, and that's what kind of warranted the decision to further lock things down because people weren't taking it seriously and staying home. So can we just start on the mobility data and what we were tracking then versus what we're seeing now? And
Sure,
maybe
sure.
for those of us just joining us, explain what the mobility data is.
Yeah, I was going to start with that.
Okay.
Good point. So basically what we have, and the only thing that we have in our arsenal right now is using a sampling of the mobility of persons here on Guam, but that's mainly through Apple and through their iOS device. Now, this is not something it's tracking every iOS device. It's really those who have enabled location services and have used Apple Maps or used that to predict ETA's estimated time of arrivals to work or what have you. So it uses that and it's completely anonymized and so in the end you just get this percentage number where 100% is our baseline, and then anything below that means lower mobility activity on the island, and anything higher means higher than baseline, of course. And of course, we always see the highest mobility on government payday Fridays. You see and that usually matches with the traffic that we see historically.
So what are we
So
looking at?
you're able to track where I'm. Well, you can't track where I'm going,
Yeah.
but you're able to tell if you have a cell phone. You're able to monitor how people are out and about on Guam.
Yeah, it's just a general. It's just a GPS location, and again, it's only when they're using the either Apple Maps, navigation system, or if they're using that even not fully open, but let's say they're using it to do an estimated time of arrival between certain areas. Like sometimes it automatically comes on as it starts predicting your mobility. But anyway, in the end, it's a sample. It's a sample of what Guam is, and
What's
it's
the
not a
sample
full
size?
representation. Sorry.
What's the sample size?
Oh, it's hard to say, and they don't give us that information. But you can just think of what the market share is of iPhones here on the island, and then a percentage of that of those people who actually enable the location services.
So, Doc, I guess. Go ahead. I mean, I just said we don't have a sample size. That how accurate is the data, and you just kind of view it as like a snapshot then.
Yeah. So what we do is that we look at it, and obviously it's daily, and the day of the week is important because it changes, obviously. So we also look at a 7-day rolling average of that. And what we do see is that you can eyeball it, and it does pretty much match up with what we see on the roads if you're out and about and seeing that and seeing when you see different spikes and on particular holidays and what have you. And like I mentioned again, on Gulf Guam payday Fridays, you see the highest bump on those days. So it's pretty consistent. And so, but what's really important about this is that it does tell us, gives us an objective way to look at compliance and behavior and responses to different policy changes that the government makes. And so with that, we can see. And so what we've done is that we looked at the mobility back in March and April. and looked at that and looked at how that related to the number of cases and even the hospitalizations. And what we notice is that once the overall mobility drops below 80%, that about 10 to 15 days after that, that's when we may see the peak in hospitalization census at GMH for COVID cases. And so it's good to know that we did reach that below 80% threshold. That was back on August 20th, which was last week, Thursday. So even before the stay-at-home order, we were already below the 80%, which was good. And, you know, but of course, our peak core one started on August 16. So with that, you know, we're seeing, and it continues to trend downward. And so we are seeing that, and I only have data up until Saturday, last week Saturday, so I don't have anything from, but even just driving to work yesterday, you know, it was good to see that the roads were pretty clear and you know, much less than in the past. Just so you know, the lowest we ever got in the heat of things back in March, where we were about like 50% mobility. That's
what does that mean, Doc? 50% of what?
Of 100%. So of 100% being our baseline, what we
so
100%
100 is normal, like normal busy government or just Guam Day people out driving.
Yes, yeah,
Okay.
and that's historically, and that goes even before. We have the data going back to the beginning of the year, and so so you normalize the mobility even before COVID. That's where the 100% is set, and Apple sets that 100%, not us.
So if the most recent data you have is from Saturday, was it? And are you able to tell where people are, like the beaches and stuff, or?
No, it doesn't tell us exactly
Okay.
the location. It's just for the area itself. Now, just so you know, this data is completely available to the public. All you have to do is just Google Apple and mobility and COVID, and you can see all the data for Guam there and all the parts of the world. And it will show you that, and you can download the raw data as well. So that's what I use to look at. Android has a similar feature, but they don't include Guam for whatever reason.
Wow.
In a discussion with FEMA just earlier this week, you know, they also rely heavily on mobility data, and apparently University of Hawaii has a way of tracking, and so we're trying to get in touch with them because they may have some data from Guam. I'm not sure what's the methods for that, but we're trying to see if they can share that so that we can have another source of corroboration.
Can we move to the hospital situation, Doc? And if you could, we'll talk GMH and then maybe put on your GRMC hat and maybe talk a little bit about that, because we saw just from yesterday another increase in the hospitalizations.
Yeah, so this is obviously this is a major concern right now. I'm still waiting for the census report from this morning, but as of last night, there was about 28 patients admitted at GMH that are COVID positive, and with another GRMC that was awaiting transfer. Part of this there's two parts of this, and this is primarily, I'm paraphrasing Dr. Jolene Ogden, is that not only are we seeing the highest numbers that we've ever had, the peak that we had back in early April was 25 admitted. We've gone beyond that, but they're much sicker now than they were back then. And so that's a major concern overall. I believe there's 4 in the ICU right now. At Naval Hospital, I believe there's 3 admitted patients with COVID positive, and one of them is ICU. So the island itself is really seeing a significant uptick. Now, that being said, one of the things that can help relieve this is that there are some patients that can be discharged, but there are social factors involved here. And so, so everybody's working hard to ensure that those needs are met and that these patients can be discharged safely. And in particular, some of them will be going to the isolation facility, but we want to ensure that they have the proper equivalent of home care nursing for them.
What do you mean social issues?
Oh, so this is typical. This is not even necessarily a COVID related issue. That when we discharge patients who are from the inpatient standpoint, there are different things like medical equipment that they may need, like oxygen or a walker or something like that, or a hospital bed. There are all these different things that may hold up a discharge because they need to ensure that we can discharge them to a safe environment. That's par for hospital medicine.
Doc, so let me
And
ask
so
you, right? Bree and I were talking yesterday. If I'm COVID positive, I go GMH, I'm going to get discharged. Well, you guys want to send me home, but my house doesn't have a self-contained bedroom with a bathroom, doesn't meet the isolation standards. I would then have to go to the isolation government facility, right?
yeah, so then that's when the ISO facility will be offered at that point. Now, I want to make it clear that nobody's being forced into these ISO facilities, and in fact, it's the families and the patients themselves that are requesting that because of their concern for the safety of their own family as well. And so we're seeing that. So I don't want this to be twisted into saying that that don't seek care because they're going to trap you into an isolation. It's not that, and that they're going to work very closely with you. There, no one's going to be be locked in and forced in a way that compromises their health in particular, or the health of their family members or loved ones at home in particular.
But are we getting to that point where the isolation facility is going to be filled? And, I haven't heard about a second one opening yet, where we're just sending
Yes.
people home because we just don't have any more room at the government isolation facility.
Yeah, so that's actually being worked on very, very actively right now, because it's a major bottleneck for us right now, in terms of it's a bottleneck that once that's open, then GMH has a better flow and turnover rate, and also for GRMC that also helps because there's a bottleneck there. Now there's this concentrating of patients, right? COVID for non-COVID and so forth. And that takes a tremendous amount of coordination to do it safely. So I don't want to undermine or undersell the importance of that. And so that's really, really important. Now so with the ISO facility, so last night after the PAG meeting, we actually stayed on. So also with the PAG meeting on Zoom, was the governor was in attendance for all of that, and then
Right.
and then of course all the main players for public health. But we stayed on to kind of to address specifically the ISO facility and how to get that expedited so that that's available for patients GMAs that can be discharged, but just aren't ready to fully go home yet.
So there's this active discussion on it, and I think we've been asking about it for a couple of weeks now. So when are we looking at actually securing this additional government isolation facility?
So it's already.
Is it stuck in procurement
I'll say
or?
the details. Yeah, it's going to be one of the because remember they've been the consolidation of the quarantine facilities, and so I guess flexibility for more isolation areas that we believe they're going to convert the previous quarantine facilities into some of the ISO. So I know there's contract stuff and all that, and I won't get into all that, but that's being that's a high priority right now because of what we're seeing. And this is something that is so important because of how many lives it affects, and some of the sickest people on Guam.
What can you tell us about the recent surge in cases, Doc?
One of the things is there are very variety of opinions that are going on, and that's very fair. But one of the key things that we know that we've seen is that it's one of the hardest things, and the factors that we can't have good control over is the connection between non-household family members. And this is why the exercise thing is become a big issue, is because a lot of people use that and then they meet up with their extended family members, and then and they act human and they want that interaction, but that's where a lot of the times that's where the highest risk of transmission may occur in a lot of these cases, and then they go home or what have you, and then they so that risk, so this right now, this stay-at-home order, this is us pushing the reset button, the governor pushing the reset button, I should be more specific, and that's something that has a tremendous weight, and we know that a lot of these measures worked because of what it showed in the past. We saw what actual mitigation efforts were taken back in March and April, and then we saw the effect as it lags, and it can take up to 2 weeks for us to see that those numbers change. And so we're still within that 2-week window. So the numbers may still continue to go up at least until the first week of September. And so, we may be looking at that before we start seeing a downward trend. We're probably going to see a downward trend in the number of cases daily before we see, of course, the hospitalizations, because that's always the most lagging factor.
So,
Is there any update on bringing in staff that's needed at the hospital?
Yeah,
Remember
sorry,
the
I just
ask
want to
was
just update
made?
that we do have the ISO facilities, that it's days in Garden Court, and we're trying to convert the Wyndham from quarantine to isolation.
Okay.
I just want to be specific about that.
thanks, Doc.
So we do have them now on board. The additional
Yeah.
ISO
We always
facilities.
did have an ISO, but
No,
the key
days
part
in,
was
yeah.
converting Wyndham. Yeah, and converting Wyndham was one of the key parts here. And there's some regulations that we want to ensure that they're adhering to.
Okay. What did I ask? Oh, staffing. We talked about last week about the ask being made to the federal government. We need critical care nurses for the ICU. And I mean, Lillian's been talking about this as well.
Yeah.
Yeah, and so so as my understanding is that the it starts with what's called the DLAN request that's made, and then that starts with actually GMH making that, and then it goes through the process, and then eventually becomes what's called, I believe, an MA, or medical assignment, if the DoD is the part that's going to respond to that, which is of course the aim here. Now we have to remember that no matter what happens here, even if we peak in before the end of the month, and the census starts coming down, is that our people need respite. Our healthcare workers, our frontline workers really need the respite, and so many of them themselves are becoming positive. And so that's depleting the current workforce as we have it already. And so even if we start seeing, so I don't think any of this is premature in terms of requesting our help. I don't think anybody will argue with that anyway. But I think that's a key part there, and I want to ensure that even if we start seeing a delay in them coming, that it's still going to be necessary because of the rest that everyone needs, because we don't know what's going to happen if we get another flare up right after. So we want to be prepared for that. But my understanding is that I think it's at least a 30-day request. For that personnel help, and I don't have any other information on timeline.
Right on.
All right.
Okay, Doc.
Thanks, Doc.
Yeah.
What are you hearing though, man? I know you are you hearing we're going to extend, or?
Yeah. So the key thing here is just to understand that I think that's great. The poll that you guys are doing, because we need to get a finger on the pulse of the community in terms of what they feel, because a lot of times there are very loud mouths on the island who make a lot of noise, and we have these me protests that are more about me as opposed to being about what we can do for our community and protect each other. And I'm glad that's being reflected in your polls and what your sampling that you're doing, and I think that's an important part, and that's an important voice that we have to listen to. So I applaud that effort, and I applaud everyone's ability to speak out. So the extension, it remains to be seen, but it might be a variation of it. I personally, my opinion is that I would like to see at some point we've already, we had the reset button especially with the parks and beaches and exercise. I think that's a part that we can reconsider, right. Going back to then. And with Mayor Hoffman on earlier, one of the discussions with the PAG, it was that it's really recruiting and having a very specific system of recruiting the mayors to help in terms of the sort of policing of compliance. And that we don't have to necessarily go to law enforcement and go through that process, and we don't necessarily have to have a tattletale system where you report and you call the legal authorities, but maybe a specific hotline where sort of the mayor's office, and that we report a certain activity and then let them handle it from there.
Right.
So that's maybe something that's more conducive. They know their constituents the best and can communicate the best with them. And so not everything has to have a law enforcement angle to it. And this is one that I think really is appropriate for that. But it has to be a good system and a formalized system. And they need the support to do that as well. That we can't just tell them, now it's on you. That we really need to support them. I know we got to go, but I just want to make one last point. And that's the importance of that's, I think, being really undersold here is that I know we talk about washing our hands, wearing our masks, and social distancing. I want to remind everybody how important it is to circulate, to have air recirculate when wherever you are. And so what that means is that if you're at home, open the window, let new air come in. And so, especially when there's more people in the house, if you're in the offices, give a chance for 2 points of air to flow through, and have that air exchange every, frequently. And I think that's an important part. And if you have an aircon, yeah, that helps, filter some. If you have an air filter, air filtration system, then that's great too. And that's what I have it right here on in the back behind me, and that's to really help do that. And believe it or not, that can make a big difference. Dr. Fauci right now is really pushing that, and so I'm just echoing that, his words.
All right. In the words of my late grandmother, fan me, fan. So turn on the fan, open the window.
Exactly.
Thanks, Doc.
Thank you.
Stay safe.
All
Right on. Hang in there.
Take care, everyone.
Yes, wash your hands and your thumbs and your feet, which are the hands of your legs.
Okay.
Okay. All right. Let's, we'll just move over to Dr. Hoa Wen of the Physician Advisory Group. He's actually the chair. Doc, we're going to take a real quick break.